start talking about this. This is actually, it's interesting. When I was casting about for a master's thesis topic, I ended up doing female delinquency. And then for my dissertation, I was encouraged to think about doing something else. And between the time I'd written my master's thesis and my, trying to find a dissertation topic, the state of Hawaii had legalized abortion and was the first state in the country to give women safe and legal access to reproductive services, the whole range of reproductive services, including abortion. And as anyone who's gone through a pregnancy test, and I'm very anxious, I get every disease I read about, and I got pregnant practically every month. I was in graduate school. Not really, but I thought I was. And so I know a lot about reproductive services because I would go and get checked. And I remember one time it was equivocal, and I remember having talked to a counselor about possibility of getting an abortion because I knew I wanted to go through school and this wasn't the right time. And so I've really lived this, both in terms of being the first state in the nation to grant women this right, and then also in more recent years to see what's been happening in the United States and elsewhere in the world. As you're going to see, unfortunately, for the world, U.S. policy around this particular reproductive right has worldwide implications. So I come to this out of the work that I've done on the policing of girls' and women's sexuality. And I think, unfortunately, what's going on in the United States is a case study of a larger way in which the criminal justice system could get implicated in the policing of women's sexuality. Now, to understand how feminist criminology is going to enter the conversation about reproductive rights, we have to take a slightly different stance than has been taken up to this point in the U.S. and I think to some degree in New Zealand, where the discussion about reproductive rights has really been squarely placed in the medical and health systems world and not in the political world. But I think I'd like to argue that we need to take a step back and we need to look at systems that attempt to regulate women's sexuality and to go into sort of one of the really, I think, foundational texts in feminist theory. We're talking about Gerda Lerner's The Creation of Patriarchy, in which case she talks about the fact that the commodification of women's sexual and reproductive capacity is an essential feature of women's subordination. Women themselves become a resource acquired by men, much as land was acquired by men. She even argues that women as slaves were sexual slaves. And this interface between our status as male property and then our attachment to the ways in which men defined us as either good or bad women. Again, defined wholly by men in relation to our sexual capacity. And reproductive capacity. So women were the sexual property of men. And I always tell my students, because they, oh, weddings, oh, engagement rings. I go, that's a legacy of slavery. Did you know that? Putting that ring on the left finger of and I don't have a wedding ring on that finger for that precise reason. I ripped it off my hand as soon as I read that. But and you come down, da 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 da, and who's bringing you? Is it your husband? Who's coming down the aisle with you? Your father, your owner, passing you to your new owner. Nobody brings him anywhere. He just stands there and takes control of the property. So getting our students to see that these systems of sexual regulation of women's bodies is political, not medical. Emma Goldman understood this, as did Ben Reitman, very clearly. And this is a picture of Emma Goldman heading off to prison, where she would spend 2 weeks in prison for having attempted to distribute information about birth control. In those years, birth control was illegal. And what she says is important because she and the other anarchists in the U.S. were working separately from Margaret Sanger, who worked more in the kind of health arena. Goldman and Reitman were clearly political. And what they said was, what she said was, while I'm not particularly anxious to go to jail, what a great phrase, I should be glad to do so, if thereby I can add my mite to the importance of birth control and the wiping off of the antiquated laws upon that statute. She does spend 2 weeks in a prison workhouse. She comes out and is released in May and speaks to a crowd of 3,000 people. So I'm grateful to my colleague Kathy Ferguson for writing about this and important parts of our early history around especially sexual freedom and the connection between sexual freedom and the access to abortion and contraceptive services, the whole range. Wait. Oh, shit. I'm sorry, Suzanne. I've got my button on in here. I've got to put on my button. I was in the second wave of feminism, so I got this legitimately. If men could become pregnant, abortion would be a sacrament. Okay, so this is my little, it's now a historic and folkloric collectible, but I was involved in those marches and those demonstrations, and I remember chanting, you know, slogans like, free abortion on demand, sisterhood is powerful. You know, those were the things we used to talk about. Not, oh, please, doctor, give me an abortion. And I guess in New Zealand, it's 2 doctors you have to go to get them to sign off on your abortion. It is who we are, and it is our right. The critiques of the second wave of feminism, though, are important to consult. And the critiques basically revolve around the fact that we can take a very legalistic approach to legal access to abortion, and is it still there or not? And this author contends that we need to understand reproductive rights more broadly. We need to talk, and you're going to see later in this presentation, that we really need to talk about access and meaningful access, especially like in island communities like ours. A reporter is just talking to me from Mother Jones, and he's pointing out something I didn't know, which is that on the island of Oahu, women have access to abortion services, but none of our neighbor islands have access to abortion. That means a young woman who discovers she's pregnant on the island of Molokai or Lanai, or even the Big Island, which has a very high teen pregnancy rate, those young women are going to have to not only deal with negotiating that good girl, bad girl, uh-oh, now I'm pregnant experience, they're going to have to, assuming that their parents are supportive or that they have friends who are supportive, they're going to have to take a flight to Oahu, and Oahu flights are not cheap. They're expensive. So access is important. Issues of sterilization and other ways in which women of color's reproductive rights were also interfered with. We need to look at those as well. So we need to update our discussion points. And we got a little help with that. This is actually the interview in which Chris Wallace got, it was somebody else, yeah. Chris Matthews, I'm sorry, got then presidential candidate Donald Trump to say that women should face punishment for seeking an abortions. Now, he has backed off of that, because even the right to life in the United States doesn't take the position that we should punish women who are seeking abortions. Hillary Clinton, as a candidate, and Bernie Sanders were both strong proponents of abortion rights. Actually, Clinton was a little better than even Sanders, wanting to overturn the long-term prohibition on federal funding for women seeking abortion. However, Clinton, once she got the nomination, picks up Tom Kaine as her running mate, and Tom Kaine was a moderate Democrat who actually had very complicated and somewhat negative history around the issue of abortion. So that's the kind of thing, unfortunately, that happened to the Clinton campaign in the general election, was that she made some choices politically that some of us wish she hadn't. So as a result, this is who we have in the White House. And this is this is Donald Trump signing the global gag rule. And I'll be talking more about the global gag rule later in the talk. But notice what's missing from this picture. And you tell me what's missing from this picture. There's not a single woman around him. How about ethnic diversity? We have any of that going on? None of that either. Well, listen. stick with it because it's going to continue. This is another group of all males, 25. This is a group convened by Mike Pence. They were attempting to undo Obama's landmark Affordable Care Act and replace it with a really wretched piece of legislation that the Republicans had ginned up, which would have rolled back women's access to maternity and reproductive rights and contraceptive rights. But again, just look at who's doing the thinking and the kind of people suggested that this administration, this was deliberate. This wasn't accidental, that they, didn't have any women in the room. No, they didn't want to have, this is their base. They want to see this. They want to see this pugnacious, misogynistic collection of unapologetic opponents of women's rights. And that's who they've collected together. Unfortunately, they have also been able to name Neil Gorsuch to the U.S. Supreme Court. We have a very fragile situation on our U.S. Supreme Court, and there was some good news, actually, summer before last from that court. But Neil Gorsuch is particularly worrisome because he was involved in the Hobby Lobby decision, which was the decision. Anyone know what that is? Maybe I should find out if you know. Yeah, go ahead.
It's the decision that the business Hobby Lobby didn't have to provide reproductive.
Yes, right. That suddenly owners of corporations can have their religious beliefs basically imposed upon their employees, and that there would be no problem with this. And that is going to be expanded. Trump in recent days has just made a point of saying he is going to expand this right and enforce this right in broader terms. And they're expanding it around this is not abortion now. This is contraception. And just what kind of contraception your employees want, apparently now employers can have a say in that. So very worrisome development. And Gorsuch was the author of this Hobby Lobby decision. So we are, it's going to get exciting. But as much as there was a sort of action at the federal level in terms of the election and access at activity at the U.S. Supreme Court level, most of the action over the last couple of decades in the U.S. has been at the state level. And what they've been doing at the state level is basically imposing more and more and more conditions. And what you have here is a graphic that basically demonstrates how the right wing in America simply went after a series of restrictions on women's access to abortion in ways that make it harder for them to gain access to the service. And each one of them in and of themselves they're always lodged within the context of this is good for protecting women's health. But nobody's fooled, because the effect of this has been to make it much harder for women to gain access to abortion. In 2000, this is all wonderful graphics that the Guttmacher Institute in the U.S. have produced. You can see that basically 31% of women were in hostile or semi-hostile states in 2000. By 2014, we are talking about 57%. So basically now over half of the women in the United States find themselves in states where it's extremely difficult for them to get abortion services. So while it's technically legal, they're whittling away at our access. This was the case, though, that changed things and, in fact, made it more, well, again, this was a fragile victory. Kennedy went with the liberals and basically said that a whole series of regulations that were put in place by the state of Texas did make it essentially difficult for young women to seek abortions in the state of Texas. These restrictions had closed half of the clinics providing abortion services in the state before this decision. So this was the whole women's health. It was a vote of 5-3. So it was actually a surprise to people and an encouraging one. Since then, we've had less to cheer about. But the other thing that I think we need to start doing is we need I should back up just a second and say, when I started doing this work, because I'd done my dissertation on abortion seeking, I forgot to tell you that part, I knew that young women were facing this decision because I'd faced it. And so I wrote my dissertation about, having conversations with women who are either having abortions or carrying unplanned pregnancies to term. And I was looking at women who were facing what I called the motherhood decision, which is the decision that propels you into either being a mother or not being a mother, because I knew that was the thing that made the most radical difference in women's lives. What I didn't know at the time was that nobody studies abortion. No one even says the word. And I would urge you to start saying the word. And my publisher, why I'm doing this talk and this book, is because she said, no one's studying this, Mita. No one is writing about this. And so I think what we have to do is break the silence, and we need to do it as academics, and we need to do it politically. So anyway, and we also need to do research on it, and I'll come back to that at the end of the talk. But the first thing about the research is it begins to shatter some of the stereotypes. You'd have, if you looked at all those men, where are they again? I like looking at them. Yeah. I mean, really. Are these the guys that should be in charge of our bodies and ourselves? I don't think so. Okay, back to the data. You would think that abortions were, that women seeking abortions were flying off the charts, considering the outrage that these men have been expressing. But the absolute opposite is the case. We have the lowest abortion rate ever observed in the United States. So the rate, in 1973, when abortion was finally made legal across the U.S., the abortion rate was 16.3. We're now down to basically 14.6. So it's not that huge numbers of women are having abortions. This is working. Having a range of reproductive and contraceptive rights available is lowering, not increasing, the rate of abortion. The other thing that you need to know is this is not really about teenagers. It's about the people who attend the University of Auckland. It's about our students at the University of Hawaii. It is about women in their 20s. This is good news. I mean, normally when Dave and I have to study youth gangs, we have to go into scary neighborhoods and, talk to, kind of edgy people. And you can do this research right here. Okay? Because that's who's having abortions. Basically, 60% are women in their 20s. And yeah, you don't even have to worry about your car having all of its parts on when you parked it, when you go to pick it up. All right, well, or maybe not. I'm not sure what the university's like. But the other thing, though, is that many of the women who are having abortions already have children. This is not anti-child, pro-child. This is not anti-motherhood, pro-motherhood. This is people trying to plan their lives so that they can do the best for the kids they have. 60% essentially have a kid already. They just know they can't afford another one, because the story here is really about poverty. It's really about not having the money to be able to support the children you're looking at having. And again, it shouldn't surprise us, because if you go around here and you find out where people are working, they're not getting paid enormous amounts of money. They meet the technical definition of poverty. I mean, I used to get rental supplements when I was going through graduate school. I know what it's like to be poor, and I started shopping in thrift shops because that was all I could afford. Now it's fun for me, and I still do it. But I also know that I used to do it because that was the only option available to me. The important thing, though, to know is at the end of the day, 30% of American women will get an abortion by the time they are 45. 30%. You would not know that from talking to people, because no one ever talks about this, or at least they don't in the States. And yet it's a vital resource. Okay, we're going to shift gears a little bit and talk about what's happening worldwide. People think if you criminalize abortion or make it less available, that will end abortion. Those men sitting around that table. What really happens? If you said, yeah, go ahead.
It's driven underground?
Yes. It's not that women don't still seek abortions. They just have to seek illegal and unsafe abortions. So worldwide, a third of the world's women, over a third, live in highly punitive states where it's virtually impossible to gain access to abortion. And the bad colors in this chart, if you will, and the most... Now, this is going to be interesting because some of these same parts of the world are also dealing with the Zika virus. And one of the points that I make, and I'll send this paper that Tanima Hadi and I have done on this issue to Dave if people want to see it. In the piece that she and I wrote, we speculate that one of the things that really broke the dam free on abortion services in the 70s was the rubella virus, and the fact that that suddenly women could be exposed to basically a virus that would give their children enormous deformities. And so not having abortion available meant that, you know, people were having to give birth to really, really damaged and dying children. And it was enough to turn the public tide in the 70s in the US to provide the importance of providing this service. In Central and South America, the Zika virus produces some of those same outcomes. And so, unfortunately or fortunately, that medical challenge may provide a political opening to talk about the need for reproductive services for women. The numbers and consequences of highly restrictive abortion laws are sobering. There worldwide are 19 million unsafe abortions provided every year, and 78,000 women are estimated to die in each of those years that we're talking about. So 78,000 women dying, and millions of women having to seek unsafe and often very damaging medical procedures outside of medical care. Speaking of global medical care, here's one of the things that's the worst about the global gag rule. The gag rule was initiated by Ronald Reagan in the 80s, and basically it said that people who give women even information about abortion services should not get any money from, or will not get any money from the U.S. To help those particular agencies. So that was when it got started. And every time we've had a Democrat come in, so when Bill Clinton came in, the global gag rule was rescinded. And what it really has the effect of doing is not providing women in third world countries with information about contraceptive services. So it's not just abortion, it's also contraception, because those same agencies provide all those same services. But what is insidious about the Trump extension and reinstitutionalization of the global gag rule was the expansion of the rule's powers, so it no longer applies solely to family planning assistance by the U.S. government, but also to funding NGOs focusing on disease control. Efforts to address Ebola, Zika, and other threats to world health may be compromised. In the old days, the old global gag rule meant that basically $575 million in family planning funds were not given to NGOs in the third world. Because of the Bannon-Trump ban, it's $9.5 billion of health money that will not be available to women worldwide. So it's a much broader expansion of the global gag rule than we saw in previous administrations. And, you know, of course, Planned Parenthood has been on the, you know, saying we should undo this. But unlike some of the other Trump things where it's been undone or stalled, like the travel ban or these other things, this has not been undone. This has happened. And just the last couple of days, they're trying again to expand that Hobby Lobby thing that we're talking about much more broadly, so that women will have access to the morning after pill. They're going to begin to go after certain forms of contraception, some of the ones that are the most vital for women, saying they're kind of abortifacients, even though there's no science to suggest that. What there is science to suggest is that, and this is where it's wonderful that we have the United Nations to help us. This is a report by Juan Menendez, the UN Special Reporter on torture, and he focused on the lack of access to abortion as a form of abuse in a healthcare setting, much like forcing drug addicts to detox without medical support, that is tantamount to torture. And, you know, we might imagine that in these, you know, really remote third world countries, that's what's happening, but it's also the kind of thing that's happening in places like Ireland, where a South Asian woman died because the hospital refused to give her access to abortion in the year 2012. Now, I will say that we have some wonderful, encouraging things coming out of Ireland and of women in Ireland pushing back on that, and I hope I have a slide that made its way in here. But I think it's really important that we talk about this as torture. And we understand these hospitals have the ability to give women the services they want and are asking for. And the denial of those services is something we need to talk about politically, not just medically. Speaking about Ireland, here we go. You know, we had thousands of women in Ireland, and in fact, one of the authors of one of the papers in this journal that I edited was talking about the situation in Ireland, because in Ireland it's extremely hard to get an abortion. So what happens? The Irish women are forced to go to England to get their abortions. So again, it's, you know, instead of having the service available where they live, they have to look at a big expense, and they have to go on a plane to get there. So this is just to say, this is a political issue, and people are marching on the streets for this in other parts of the world. I think we need to talk about it happening. We need to see more of this kind of you know, political engagement here. I've talked earlier about the need to challenge the climate of silence and the shame over the procedures that I'm talking about here today. And that, in fact, has happened. There's an interesting social movement that happened, although it's been shut down because the internet trolls were so violent and abusive to these young women. But basically, they basically got online, and this is Amelia Sono and her friend Linda West. And they basically said, a shout is not a celebration or a value judgment. It's the opposite of a whisper, of silence, said Miss Bono. Every woman who supports abortion rights has been silent and told that they were supposed to feel bad about having an abortion. So I think even the political act of saying that you've had the procedure and that it was important for you to have access to that procedure and to document that is important political work that we need to consider. We need to get things out of the hands of the doctors and back into our hands, because I think there's that sort of hierarchical structure in medical land. You know, the doctor is and you, the patient, and I think we need to recognize, obviously, that we need medical practitioners to help us through this process. But because of our mammalian, you know, I was at a presentation of this paper, or an earlier version of this paper in Portland, Oregon, and somebody started launching into, you know, we're just unlucky mammals, and there are all these mammals that can just get rid of their fetuses if they don't want them. But we're not in that boat. We do need help. But this is also, this was a shot, you know, after everyone woke up and realized Trump was really our president. It was literally the next day, and people poured into the streets, I'm told, in Auckland and elsewhere. Certainly on the island of Maui where I was, people were in the streets just saying, and it was very clearly women saying that, you know, this is not okay. This presidency is you know, deeply troubling to us. So we need to document the positive aspects of access to abortion and affordable contraceptive services. Going back to my, you know, thing, I had two buttons. This one that I'm wearing is kind of on wrong. I had a button that I'm wearing today that said, if men could get pregnant, abortion would be a sacrament. I have another button, much faded, but it says, we have charts and graphs to back this up, so fuck off. I like both of those. And if you've been to all of my talks, this is, like all my talks have a lot of numbers and a lot of charts. But really, the attitude that I bring to this is one of being a critical and progressive criminologist, and thinking about my research agenda as something that advances women's rights and girls' rights. And that's what we need to do. We need to think about, and I'm not sure what this would be. I remember I had a visit to UC Irvine, and we were having dinner with the graduate students who had invited me. I beat out, who's the guy at Harvard? I was really amazed at this, Rob Sampson. The students voted for me instead of Rob Sampson. I was like, woo! Wow! But I don't have the job at Harvard either. Anyway, we're having dinner, and suddenly this young woman started talking about the fact that she just had an abortion. And the guy that was sitting next to me was a little awkward, you could tell he was a little uncomfortable, but we were all giving her support and saying, but I was listening to her going, we need to hear more of these stories. We need to be able to think about ways to do this research. Certainly the Guttmacher Institute gives us lots of numbers, but I think we need mixed methods to figure out how to do this research. We need to document what's going on, both in the good states and the bad states. I've urged my friends in Texas to document how difficult it is for people to get abortions. We need to think, I'm just thinking about what are the data that are available to us. And again, we do have in the age group that comes to campus, the people who are in need of these services. So we're really being advocates for the women who are all around us. So what did I do? I did say to my friend Fran Burnett that I would edit a special issue of a Journal of Women in Criminal Justice, and I did do that. Here's the articles, but you'll notice that we had Ireland and we had the piece that Tonima and I did, but all of the rest, they were good papers. Andrea Ritchie has been doing wonderful work on the racialized aspects of stop and frisk, and the fact that black women experience much worse intrusions than do black men in stop and frisk cities like New York. So she's doing great work. Lisa Pascoe, we know Lisa, doing great work on what's happening to girls in detention centers and training schools in in Colorado. But we need more. Notice how few pieces really were on abortion. I really was reaching out to my friends in Texas to say, is there something you can do? Can we talk about access in different parts of the country? We're it. There's nobody else. There's nobody going to fund this. This is like gun research. Nobody's going to do this. Nobody's going to do this. Give us the money to. So we're going to have to be creative and wily. Fortunate we're good at that. Really, I think at the end of the day, we're back to we need to do global and intersectional research. We need to document the harms of the global gag rule. We also need to do a lot to get people understanding that this is a political and feminist issue. It's not necessarily a medical issue. It's a human rights issue, not a medical, privacy issue. Because medical privacy, no one's going to put that on a placard. Give me medical privacy. What the hell does that mean? But it does. Having control of our bodies and having control of our futures is important, and that we can get behind. So with that, I'm done with things that I had planned to say, but there's some time for other conversation if you have questions or comments. So.